reason why I decided to get the COVID vaccine were some very simple reasons. I got it for my father.
To protect my patients, my family, and friends.
See my relatives again. I miss our big Sunday dinners.
It's just another layer of protection to feel safe and not to spread it amongst the community.
Getting rid of that fear of going out and doing things that we used to do a year ago without thinking twice, you know, I think that's important too.
I'm doing it for my grandbaby, and I'm also doing it for my wife.
My husband is a heart patient, and I don't want to give it, of course, not giving to him.
I also have immunocompromised parents, grandparents. You know, I still want to see them like in the midst of all of this.
I think that it's the next step in our getting to normalcy.
I have a mom who has lung cancer, and one of the reasons for me was to protect her.
I have a responsibility to protect myself and, by extension, protect others.
There's millions of people that passed away from this disease that would be first online to get this shot.
It gets me one step closer to seeing my grandchildren out in Arizona. I haven't gotten to see them for almost a year.
I made an informed decision to get the vaccine to not only protect myself working on the front line, but also to protect
my family, my friends,
and my coworkers. And also, it's critical to get the vaccine to protect our patients.
Nobody wanted to be in this pandemic. Nobody wanted to be in this craziness with the virus. But when science is out there proving to you that this vaccine is safe, trust. You know, trust in the vaccine. Trust in the field that you chose.
It never popped in my head not to take it. Number one, being a frontline worker, seeing these sick patients come in here. I don't want to get emotional. That was number one for me to take the shot.
If we're ever going to get back to our normal routine, enjoying our friends and family, going out to restaurants, going out shopping without having to worry about getting infected or infecting others, we really need to consider getting vaccinated.
I really trust the science, and I want my patients to be able to have an example to follow.
And being that there's just been so much loss, I just felt it was my duty and my privilege, really, as a nurse to be able to do this.
I barely felt when she gave me the injection, which was awesome. It was a little sore a few hours after, but within 24 hours, maybe even 48, you couldn't even tell.
I had a good experience, nothing major, just our mild, symptoms that you would normally get maybe when you take the flu shot.
I had no difficulty from it other than just a sore, achy arm, just like I did with the flu shot or a tetanus vaccine.
I'd say getting the COVID vaccine is very similar to the flu shot, just as easy. And then the only side effect I had from it was just a little bit of a sore arm.
Being in the healthcare field, it is imperative that it is our sense of responsibility to instill faith in the people of our community regarding the safety of this vaccine.
It's not a live virus. It's not any sort of an agent that can make you sick.
When I saw the data coming out that this vaccine is been produced by a new therapy with the help of the messenger RNA, and the way I understand how messenger RNA works, I thought this was a very safe and most effective way of helping to produce antibody and fight this infection.
I tell people that the safety portion of running the trials and everything, that was not neglected at all.
So I think it's important that you do research for yourself. I think that you need to get on reputable websites that follow the science and ask your doctor, ask your peers, talk to our infection control doctor, Dr. Shaw, and just work out those things that are holding you back, because I think the only way that we're going to get out of this is to have more and more people vaccinated.
That is our light at the end of the tunnel, I truly believe.
I would say do your part.
We need to try to get our lives back together. If you can be a part of stopping it, I think everyone should be.
I believe it's our responsibility.